time it is. Marvin Devine, Hoover, Axel, and you know how we do.
Yeah, I got the juice. Whip game cool, make them look like cool. Always play cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof.
You already know what happens when we link up. Let's go.
Yeah.
Welcome. Good morning, good afternoon, wherever you are. Welcome to another broadcast of Kidney Hub East Africa. I am half your host, Steve, the kidney nurse. Thanks for joining us. How's everyone been? I mean, happy Sunday to you guys. It's been at least about 4 weeks since Brother Moses and I been back to do this show. Today, we have an important show that affects millions of people, and they don't even know it. But we got a twist to this. We have a guest. Now, we're talking about nephrotic syndrome, living with it. And you may say, like, Steve, what's nephrotic syndrome? I'm glad you asked. Nephrotic syndrome is a kidney disorder characterized by a group of symptoms, including proteinuria, which is loss of protein in the urine, hypoalbuminemia, which is low levels of albumin in the blood, edema, which is swelling in the feet, and hyperlipidemia, which is high cholesterol levels. Now, let me bring on half of our host, Brother Moses, all the way from Kenya, and I'm going to let him introduce our guest. So let's give Brother Moses the VIP intro, as always. Brother Moses, what's going on?
Well, Brother Steve, how are you doing?
I'm doing fine. Welcome back. It's been a while.
Really, it's been a while. This is being our first broadcast.
Yes,
really...
of the new year.
Oh, yeah. All right. So
and let me say Happy New Year to everyone. Happy New Year to you. Happy New Year to the warriors in East Africa. our guest.
Likewise. Happy New Year over there, Brother Steve. Happy New Year to the
Thank you,
entire
thank
team.
you. It seemed like our guest dropped down. I'm not sure what happened. I know the internet in Kenya is a little unstable, but hopefully she'll return soon to the broadcast.
Mm-hmm.
And so we are going to be talking about nephrotic syndrome. Now, that's one topic we haven't discussed, and that's an important topic. And as I mentioned, nephrotic syndrome is a kidney disorder characterized by a group of symptoms, including, like I said, proteinuria, hypoalbuminemia, edema, hyperlipidemia, which is high cholesterol levels. So, what made you want to discuss this topic?
Well, Brother Steve, this is really a rare condition, a rare disease. And even most patients do not know that it is also a kidney disease. And because it is quite rare, what I don't know, Steve, is that does it affect women more than men? I'm not sure about
I
it.
had to research that.
All right.
But then I know here in the United States, it's, many people do have that disease and don't even know it as well.
All right. So when I met Roselyne, I thought this is quite rare and we need to highlight this other than just the traditional CKD that people have and maybe the obvious causes that lead to even CKD and then to kidney failure.
Mm-hmm.
So
Brother
that
Moses,
is the reason.
Can you call our guest? She hasn't came back yet.
Oh, really?
Yes.
Let me just call her as we continue.
Okay.
Yeah.
So while Brother Moses is taking care of that, again, with nephrotic syndrome, it's characterized by a lot of symptoms that people may not know that they even have nephrotic syndrome. That's why it's very important to go get checked for kidney disease. Now, we're going to talk to Roselyne, see how she's been impacted with nephrotic syndrome. Let's talk a little bit about the treatment for nephrotic syndrome, because if you had nephrotic syndrome, that doesn't mean that you're on dialysis, okay? It could be something that can happen and go away. Now, in fact, I've dealt with that. I've dealt with nephrotic syndrome and didn't even have a lot of these symptoms. The only symptom I had was the protein. I was spilling 3 grams of protein in my urine. So, Brother Moses.
Yes.
Was you able to reach her?
Yeah, she says network, but then she's connecting as soon as possible.
Okay. And so, with nephrotic syndrome, again, the treatment for it, all right, is a combination of medications, dietary adjustments, and management of symptoms. Okay, here we go. Let's bring her on before we lose her again. Without further ado, we're going to bring on Moses. You introduce her.
All right. We are introduced to you our super guest, none other than Roselyne Onyango. Onyango.
Miss Rose.
Hi, how are you?
I'm great. How are you?
I'm very fine. And you?
I'm fine. Thank you. Welcome to Kidney Hub East Africa.
Thank you so much.
Go ahead, Brother Moses.
Yes. Evening, Roselyne.
Evening to you, Moses.
We are super excited to introduce you to this program for the first time. And I was glad the way you are really prepared about it. So
Yes.
without saying much, Roselyne is our super guest. And she will also be sharing part of her story to inspire, to educate, and such like. Thank you so much, Roselyne, for coming. I am your co-host, Moses Kennedy, your kidney ambassador.
So,
Back to you, Steve.
Sure. So, Ms. Roselyne, can you
Yes.
share with us your personal journey and experience with nephrotic syndrome?
First, I have to say that I'm glad to be on this show. And my journey with nephrotic syndrome has been a sad journey filled with so many ups and downs. And I was first diagnosed with nephrotic syndrome when I was in Form 2, that is 1997. That is when I was in a boarding school, and I noticed I had a lot of swelling in the legs, and even in the hands, and even I had some puffy face. That is when our school nurse referred me to a hospital in Nairobi, because the school I was in was very interior. So I was referred to Nairobi where for some further medical intervention. So that's when I went to a hospital, and they just did a simple urinalysis test. And from that simple urinalysis test, that is when the doctor who saw me at that particular time realized that I had a lot of proteins in the urine. And now from that time is when they started the investigation about now what could be wrong with the results. So when they did further investigations, they did a kidney. There was a kidney biopsy that was done, and also some kidney scans that were done, and that is when the diagnosis was nephrotic syndrome. So from there, since I was in a very interior, remote school, so the doctor requested that I be transferred in a nearby school whereby I could frequently attend my clinics. I used to attend my clinics at Kenyatta National Hospital like every Friday. And that's when I was started on some medication. And of course, for the nephrotic syndrome, the first drug that you'll be started on is the prednisolone. You'll be given also other drugs, other diuretics to help you remove a lot of water that is detained in your body. So with that, you can imagine being in Form 2 and you have nephrotic syndrome, and the disease itself is weighing you down, and also the medication is also weighing down. So it was really not easy for me to concentrate in school so much, because as somebody who is in Form 2, you have a dream of probably becoming something in future. So I think my teachers were very lenient, and I think they just wanted me to pass through the Form 4, and they didn't really mind about the grades because my health at that time was fast. So I thank God, because in 2000 I went into remission, and of course the disease subsided, and I went through my college. So when you have nephrotic syndrome, there are some complications that come along with that disease. And one of the complications that come along with the nephrotic syndrome is you're so much predisposed to blood clots. And now I can say that being a nephrotic patient, I've also had frequent episodes of blood clots. That's what we call the deep vein thrombosis. And of course, as a nephrotic patient, when you're predisposed so much to blood clots, then of course there are some risk factors that you should look into. And some of the risk factors that you should look into are, as a nephrotic patient who is predisposed to blood clots, first of all, pregnancy itself is a risk factor for blood clots. So as a nephrotic patient, when you get expectant, you really have to be very close with your doctors. You have to be very close with your hematologist. You have to be very close with your kidney patient, because sometimes the pregnancy itself makes your levels to be very high. So you really have to work with your gynecologist. You have to work with your kidney doctor, and you also need to work with your hematologist, because you're so much prone to developing blood clots. And now, after going into that remission, of course, those episodes of blood clots because of the disease itself. Then I remember also in 2016 when I was having my third baby. That's when also I had a very serious relapse on the nephrotic syndrome. And I remember that time the protein levels were very high, the albumin levels were very high, the creatinine was very low, and also I had to also be up and down with my kidney specialist, with my gynecologist, with my hematologist, also to check if I'm anticoagulating well and all that. And also in now 2023, there was also another relapse where I started having the edema. And when I went to check on the proteins, I was leaking a lot of proteins in the urine, that is +4. And when I did the microalbumin test, it shows that I had very high levels of the microalbumin. And when I talk about the high levels mean you're leaking almost something like 12 grams per liter. And when you leak a lot of proteins in the urine, also it means also you are so much prone to developing to going into that stage of kidney failure. So because I'm somebody who understands my body very well, and I'm somebody who has gone through this condition, and so I really understood my body very well. And I remember I went to my doctor, and they did a repeat biopsy, and that is now the last year. And the repeat biopsy showed that I had now membranous nephropathy. Neuronephropathy, and membranous nephropathy is also a type of nephrotic syndrome that now manifests itself with losing a lot of proteins in the urine. And I can say that the journey has really not been easy, because you really have to be in the hospital after every 2 weeks. After every 2 weeks, you have to check on the nephrologist has to check on you. You have to do urinalysis tests. They have to check the urea creatinine ratio. They have to check your potassium levels. They have to check your creatinine levels, because now when your creatinine levels are going down, then that's what is a very key indicator that you may be sliding into a kidney failure. So in all this, I thank God, because the proper intervention, the proper early intervention has really made me not to slide into dialysis. Because sometimes you find that people have these symptoms and they go unnoticed, and by the time they are going to the hospital, you find that you are at the end stage renal failure. And when you are at that stage, now the only thing that is remaining now is the dialysis, and probably after dialysis is a transplant. So personally, I think I've really been very cautious about my body. I've really been listening. I listen so much to my body. And anytime I have an edema, I rush to the hospital. Anytime I feel like my left leg has some pain, I rush to the hospital, because I know I could be developing a blood clot. And anytime, also sometimes it's also good just to check into the hospital and have your cholesterol checked, because sometimes when you have nephrotic syndrome, your cholesterol levels go very high. And when your cholesterol levels go high, you're so much predisposed to cardiovascular disease, that is the heart attack. So I'm very cautious with my body. I'm very cautious with checking this and that. And that is what has really helped me so much, not to slide into dialysis.
Yes,
Wow.
Miss Rose, you're right. High cholesterol is definitely one of the classic symptoms of nephrotic syndrome. A couple of things that you mentioned that were very important. I mean, everything you said were important, but one I wanted to key in on is membranous neuropathy. That's one of the common causes of, there's many, but membranous neuropathy that you mentioned. And this is a condition is characterized by thickening of the glomerular membrane, which can be caused by autoimmune disorders, infections, and medication. And so I thought that was important because you said you had one of the common causes. The other causes are minimum changes disease. This is the most common cause of nephrotic syndrome in children. 2, focal segmental glomerulosclerosis, also known as FSGS. And then another one is diabetic neuropathy. And the next one is systemic lupus erythematosus. So it's important to know that. And then another thing that you mentioned that's important, when you first realized you was having this problem, was the swelling. Did that happen over a period of time, or did it develop rapidly when you first noticed this problem back in the was it 90s or 2000s?
I was in a boarding school, so I used to notice a lot of swelling. In the morning when I wake up, I used to have a lot of puffy face, swollen legs and hands. So when I used to visit, because that time we just used to have a nurse who was taking care of us when we fall sick. So a term has 3 months. For a whole 3 months, I was just being given some medication just to bring the swelling down. So that is when the nurse didn't know actually what was happening to me. So he didn't know that this could be one of the indications of a kidney problem. And at some point, I think he was maybe measuring on. He thought maybe I had worms, so I was being given some some drugs for worms. So that is when even with medication, these symptoms persisted, because at some point I used to pass a lot of urine at night. I used to urinate a lot at night, and then when I used to have a lot of foamy urine. So this is what really made the nurse to write for me a note, and maybe to my parents, and to tell them that this child needs a lot of medical, he needs a very proper medical attention, because the symptoms are not subsiding, and then the only drug you can be given in a dispensary are the painkillers, because we know as a nephrotic syndrome, sometimes you get a lot of muscle pain. Sometimes, and then because nephrotic syndrome also elevates the pressure. So sometimes you have to be, but by that time I was not being given the drugs for pressure. I was just antihypertensive. The only drug I could have are the normal painkillers like Panadols and Brufen and all that. So when I went home after that term is when now my father now took me to a proper hospital, where now they were able, the doctor who saw me was able to point out that there could be some chronic illness that is going on in this child. So that is when they decided that that doctor just decided to do a simple urinalysis test. That's when from the urinalysis, I remember what the doctor told my parent was, this child is leaking a lot of proteins in the urine, because a normal urinalysis should have 0 proteins. But for this one, the proteins are +4. That is a very high indicator of a kidney disease, or probably as some chronic disease that is happening in the body.
All right, Ms. Rose.
Yes.
How has nephrotic syndrome impacted your daily life and routine?
What I would say that as a nephrotic patient, first of all, there are those symptoms of nephrotic syndrome. And the first symptom that I've talked about is edema. And when you're having edema, and when you're having a very severe edema, remember you will not be active, because you'll be very sluggish. when you have a lot of water retained in your body, there's that sluggish movement that you will have. You'll have a lot of fatigue that comes along with this. Then the fact that nephrotic syndrome also causes high blood pressure, and high blood pressure itself also has some symptoms. You'll have a lot of you'll have a lot of also fatigue, blood vision. There's frequent urination also, especially that one is not noticed at night. So at some point you will, and then also there's that mental aspect that comes with it. So you'll really not be a functional person 100%. Even if you realize that, of course, when you're fatigued, you can't you can't do your course, or you can't perform your duties 100%. When your blood pressure is high, you can't function well. And so, apart from the symptoms of the disease, there is also the effects of medication. And the effect of medication, I will talk about prednisolone. Prednisolone itself is a drug that will actually control, that will actually suppress so many things when you are a nephrotic patient. But sometimes this drug also comes along with side effects. And one of the five side effects that you'll get with prednisolone also is also fatigue. It causes a lot of fatigue. So again, now nephrotic syndrome as a disease causes fatigue, and then prednisolone also as a drug that helps you, that takes care of this disease, also causes fatigue. When you are, prednisolone also predisposes you to having high blood sugars, and sometimes when your sugars are high, you also feel those symptoms that a diabetic patient normally has. So it's a mixture of so many things, and all this mixture of so many things actually lowers down your daily activities. And I would say also on the mental aspect of it, all these diseases and all these drugs, they actually causes a lot of emotional imbalance. And sometimes as a nephrotic patient, and as a patient who is on all these medications, sometimes you feel like you have a lot of mood swings, you have a lot of tantrums here and there. So you're not a functional person 100%.
Wow.
Brother Moses, you have any questions?
Wow. Roselyne.
Yes.
Really, your word caps it all. I just want to take you back
Yes.
where you mentioned that you had a lapse again after your third child, right? Am I right?
Yeah.
Now,
yeah.
How was the journey? How has been the journey from the teenage age, learning that you are now knowing a new condition that probably would really affect basically your entire life? How did you pick up? What was the turning point? I'm really interested over there. And how did you overcome this? Because most of us believe that when you get bad news that maybe could shatter your dreams and ambition, then you basically lose. But I acknowledge, from high school to marriage, to dating, to marriage, to having kids, how have you managed this? Could you please share with us also that bit? Because
I think I'm one person with very strong personality. I have a very strong personality. And the fact that I can even walk out there and nobody can read what I'm going through, that one itself makes me to be a very strong person. Because when I'm out there, I don't wear my face as somebody who is sick. I go there as somebody who is a very strong person. What I would say is, I would point out on one of the conditions that comes along with nephrotic syndrome, and that is deep vein thrombosis. Deep vein thrombosis is something that really weighs you down, because once you have a blood clot, you have to go through admission in the hospital. And when you have a blood clot, the admission is never less than 2 weeks, because the doctors cannot allow you to go out of the hospital when the clot has not resolved. So that is one of the things that really that really that that is one of the symptoms that come, the complication that comes along with the nephrotic syndrome, that is very difficult to deal with. And even after 2 weeks, you really have to take another 2 weeks or another 3 weeks to bring those levels down. That is when the doctor can even release you to go even to your workplace. So I would say that it has not been an easy journey, because as a patient, there's that emotional aspect where sometimes you feel emotionally drained. When I say you get emotionally drained, I mean, imagine frequent visits in the hospital, the medication itself. You're also a mother, you're also a wife, you're also you're also working. So you can imagine juggling all these things with your condition. So I'm somebody who, I think, I have a very strong family support system that supports me so much, and that's what has kept me going. Because when you have a very strong support system, when you turn around you and you know there are people, you have your caregivers, you have your keepers, and you have those strong support system, it keeps you going. Sometimes you can lose it when you have a weak support system. That's when sometimes you find people losing it. But I can say that what has made me to walk heads high, and maybe to push on, and maybe never to give up, is a very strong support system that I have around me.
Wow, wow, wow.
Miss Roselyne,
Yes.
how has this disease, nephrotic syndrome, has an impact on your family?
I would say that it is not easy, because your children see you taking a lot of medication. They don't understand what you're going through. They pity you because they see every time in the morning, mommy calls them and tells them, "Can you bring for me this kind of bring for me that drug?" In the evening, bring for me that drug. So in the children, it really, it emotionally, it really, it doesn't go well with them. And also, if you have your parents, of course, these are your parents who've seen you through this condition from the time you were in high school. So you can remember the emotional turmoil, or you can remember how sad it can be for them seeing your daughter going through all this. So, and also maybe the people who are around you, like your siblings, your husband, your aunties, your uncles, and everybody who surrounds you. So it is. I can say that sometimes it becomes a bit heavy. And there's that financial aspect also, where you have to, with the frequent visits in the hospital, sometimes the medical cover gets depleted and you have to go into your pockets. So sometimes it's really not easy on the family because of the financial aspect of it. And also the emotional aspect of it. Sometimes as a patient, you emotionally get drained. They see you going down emotionally, and also it affects them, because nobody wants to see a loved one emotionally draining down. So I would say that this chronic illness, sometimes it impacts very negatively on the people who surround you, because of the very many things that comes along with it.
Very
Wow.
interesting.
Wow.
Well, I want to take a pause here and talk about the primary treatment. You mentioned some of it, but I'd just like to read what the literature says is the treatment for nephrotic syndrome. And the primary treatment for nephrotic syndrome often involves a combination of medications, dietary adjustment, and management of symptoms. So some of the common medications to treat this include angiotensin converting enzyme, or ACE inhibitors, or angiotensin receptor blockers, or also referred to as ARBs, to help control blood pressure and reduce the proteinuria, as well as steroids to reduce inflammation and decrease the proteinuria. Also, diuretics may also be prescribed to help manage the edema or the swelling. Now, in addition to medications, dietary changes to reduce sodium intake and control fluid retention are often recommended. Patients are typically advised to limit their intake of salt and processed foods, as well as to consume a balanced diet that supports overall kidney health. So can you share with us if you adhere to this type of treatment regimen to help manage your nephrotic syndrome?
At first, when they call them the urea creatinine ratio and the microalbumin, when they were very high, I was started on a very high dose of prednisolone. And when I talk about the high dose of prednisolone, I'm talking about 60 milligram to reduce the inflammation also and to help in the proteinuria. And also, I will talk about the antihypertensives. And the major antihypertensive that is prescribed is the losartan potassium or the losartan hydrochloride, but mostly I use the losartan potassium. Of course, there's Lasix to help you remove the water. And also, sometimes there's a lot of heartburn. So the doctor has to start you on some PPIs, like the Pantocid. That is what we use mostly. And also, there's you feel a lot of muscle pain. So, and the muscle pull and muscle pain, they're very frequent. And now you have to be also to be put on some muscle relaxants and also the calcium supplements. So those are the common drugs that us as nephrotic patients use a lot.
Interesting. So you were you prescribed any high blood pressure medicine as well?
Which one?
Any high blood pressure medication?
Yeah, at first the pressure was very high, those high levels of 170 over 120 over 110. So I was started on the losartan, and the losartan also helps in reducing the protein, and also the Asomex. But now, what I realized when the proteins, when the levels subside, then the doctor will be forced now to withdraw one of the antihypertensive, because now you see now when the proteins are low, when the levels are not very high, then definitely the pressure also will go down. And now when you're on two antihypertensive and the levels of proteins have been maintained, then of course there's no way you can now be on two antihypertensives. So they withdraw one and they leave you with the losartan, which now has two benefits. That the benefit of lowering the blood pressure and also the benefit of controlling your proteins.
Okay.
Yeah.
So have you adjusted your lifestyle, diet, and physical activity to better manage nephrotic syndrome?
First of all, I'm on a very low salt diet, because as a nephrotic patient, that is one thing you need to avoid salt. And also on the proteins, you need to moderate your levels of proteins. And then also, you know, when you're on prednisolone gives you a lot of hunger. So it really makes you to eat a lot. So with this, you really need to control your portions in terms of whatever calories you take in, because now you know you can easily slide into that obese stage, and of course when you combine these symptoms of high cholesterol and all that, and you also slide into obese stage, then it might not really be it will not go well with a nephrotic patient. So you really need to control weight, although sometimes with prednisolone it becomes a challenge because of the hunger that comes along with that drug. So it really makes you eat a lot, and you know sometimes it prevents you from controlling your portions.
Mm-hmm. Have
Yes.
you increased your physical activity?
I walk a lot. because that's one of because now my I no longer have edema. So sometimes when you have edema, you can't really walk a lot. So I try at least in a day to cover around 10 kilometers at least, just to keep healthy. So I walk a lot, and sometimes I do a bit of exercise in the house, just the simple ones, not the complicated ones, just to help you keep fit.
Mm-hmm. Now, how often
Wow.
do you go to the kidney doctor to get your kidney function checked, to know what your GFR is, to keep you from,
Yes.
to help, so you
I,
know to manage it from going to dialysis?
Initially, when the levels were very high, the microalbumin levels were 12,000, and you see the normal one should be 3,000. So that is high above the nephrotic syndrome range. So initially, when the levels were very high, I used to visit my doctor after every. I used to frequent the nephrology clinic after every 2 weeks, and after every 2 weeks, you have to do urinalysis because they have to check if there are proteins in the urine, the level of proteins in the urine. You have to do the kidney function tests because they need to know the levels of the creatinine. You have to do the urea creatinine ratio test. They need to check your microalbumin. So those are the very, very common tests that you do after every 2 weeks. But now the frequency of visiting the nephrologist will reduce depending on the results, because initially it was after every 2 weeks because the doctor really need to check this level. Sometimes if you can easily slide into end stage renal failure if the creatinine levels are very high. So then, depending on the results, then now the doctor will reduce the number of visits, probably from 2 weeks to 1 month. And now I'm doing a monthly visit, not the 2 week visit. I'm doing a monthly visit
Mm.
Wow.
with the
Wow.
same
Wow.
result. Yes.
Wow. And Roselyne,
Yes.
this is great. I mean, noting that renal industry in Kenya is still a young industry, how did you maneuver? Because up to recently, up to 2014, the National Hospital Insurance never catered for dialysis patient or for the renal clinics that people have nowadays. Now, how did you maneuver? Have you ever even traveled outside the country, given that you are having some challenges accessing what is need to be accessed? Did you travel outside the country because of many challenges, or what were the setbacks that you encounter during your treatment? Greatest ones, please.
Yes, I think what really made me in 2018, I decided to go to India for for some further medical intervention, and what made me go there was because of these frequent blood clots. I had a lot of very frequent blood clots, and also by the time I was going to India, my kidney functions were at 50%. So I just wanted to go and maybe have a different feel of another facility, because of course the first culprit when you have nephrotic syndrome on this and this blood clots and everything, the first culprit is autoimmune disease, and one of the major autoimmune diseases that I really pointed at is the lupus and also the APLAS. So that's when I decided to go to India, probably to get some further medical intervention. And what really triggered this was the frequent blood clots that I was having.
All right. So it was for purposely second opinion, not that
Exactly.
we were shortage of doctors, right?
It was probably for second opinion. Yes.
Well, let me just take you back.
Yeah.
Just maybe 2010. I
Yes.
know it has been difficult those days because even the
Yeah.
nephrologists we used to have were very few,
Yes.
and most of them were still maybe going training. You know,
Yeah.
were you in constant visit with a nephrologist, or sometimes you were just being seen by your primary healthcare doctor?
In all these cases,
yes.
In all these cases, I was always being seen by a nephrologist.
Okay. Okay.
Yes.
Since
Yeah.
since diagnosis, that is 1990,
Yeah. Yes.
1992. Okay.
97. Yes.
All right. Then up to date, you are still getting, you are not missing any form of treatment, or maybe your treatment has never been disrupted that you can't see a doctor?
I would say yes. I would say yes. I think that is what has also helped me getting some of good doctors in Kenya. That is what has also helped me to overcome this, because sometimes I know sometimes you can go just to a normal facility and then you get a misdiagnosis, and those misdiagnoses that sometimes is what leads to somebody going into end stage renal failure, because maybe they never picked it right at the first time.
Wow, that's a true
Yeah.
testimony. That is a true testimony that we can still stop or prevent kidney disease if it is diagnosed rightfully and early enough, so that
Yes.
people do not slide to end-stage kidney disease. Thank you so much. Back to you, Brother Steve.
Oh, absolutely. That was very important that warriors know. And that leads me to my next question, because we know kidney disease impact a lot of people in Kenya and across East Africa. With that being said, what advice would you give your fellow countrymen and women and the people watching this show who have been recently diagnosed with nephrotic syndrome? What advice could you share with them?
I would advise the newly diagnosed nephrotic syndrome patients that you really need to take your medications as prescribed by the doctor. Because if you don't take your medication as prescribed by the doctor, then you can easily slide into end stage renal failure. Number two, you really need to keep your appointments. And I know sometimes it's difficult to keep your appointments because we have different challenges, but it's important to keep your appointments so that the doctor can see your progress. And I would also say that you really need to have faith that having a chronic illness is not a death sentence. And I can say that I've had it from 97 and I'm still keeping it strong. So that one can show you that it's not a death sentence. You can live with you can be a nephrotic patient, nephrotic syndrome patient, and continue with your life as a normal person. You can continue with your work as a normal person. And I would say that also early intervention also helps, because as a nephrotic patient, you really need to know your body. And sometimes when your body is not right, when you're feeling like there's something wrong with your body, you really need to go to the hospital and get it checked. Because as I mentioned earlier, nephrotic syndrome comes with a lot of complications. And one of the complications are the high cholesterol. So it's good to also have your cholesterol checked, because sometimes it's not the nephrotic syndrome that will kill you, but it's the high cholesterol that will kill you. Because you see now that one, when the cholesterol go and clog your arteries, you can have a heart attack. So that is what can kill you faster, even more than the nephrotic syndrome itself. Another thing that I want to point out is that you need to if the doctor points out that you are prone at having blood clots, then you really need to work closely with your doctors, because another thing that can kill you faster is the blood clot and not the nephrotic syndrome itself. So also for those people who probably might be having symptoms that are so much related to kidney diseases, it's good to visit your doctor, to visit a nearby clinic or to get checked, so that if there's any kidney problem that is developing, then it can be captured in an early stage, and this one can really save you, because one of the key symptoms that is so visible to everybody is the edema. So if you have persistent edemas, and when I talk of edema, I mean the leg swelling, and sometimes when you wake up and you have some puffy faces that doesn't even go away even in a month's time, or they're just persistent. It's good to go and go checked, so that the doctor can rule out any kidney condition that you might be developing. So I know sometimes people you might go, and if you're having that kind of symptoms, it's also good to avoid self-medication, because sometimes you can have the edema, then you go to the pharmacy, you're given a diuretic, then the next day you're having flat, your legs are flat, and you feel like everything is okay. So I would say that early intervention is very key when it comes to pointing out on a kidney on a kidney disease. So I would just say, and then another thing I would say, that you really have to have faith in God. You really have to be prayerful and trust that and sometimes it's also good to leave everything to God and let God take control of your life.
Those were great advice. Thank you for sharing that. Wow. Now, Ms. Rose, have you encountered any misconceptions or stigmas related to nephrotic syndrome? And if you have, how have you addressed them?
Yes, as nephrotic patients, we get a lot of stigma. And the stigma associated with this, I would say, is in relation to the edema itself. Because you cannot just walk freely with the legs swollen, because everybody will look at you and will be like, oh, maybe the people who know you will keep on asking you, your legs are so swollen. And sometimes when somebody asks you that and you know actually what is eating you up, it really becomes a challenge, because some people will not just understand why your legs are swollen. And sometimes the fatigue. Sometimes you can just look so fatigued, and somebody might think you're lazy, and you're not lazy. It's because of the effect of the disease itself, and also the effect of the drug itself is weighing you down. And somebody might think just that you're lazy. You get stigmatized, and people can think that you're a lazy person. Another thing is the mental aspect of it. As a nephrotic syndrome patient, you get a lot of mood swings, and you get a lot of emotional imbalance. And also with the medication that you're taking gives you a lot of you get a lot of mental mentally you sometimes you're not okay. And so that stigma also that comes with mental health, because as a nephrotic patient, you can just decide something. You can just wake up and you feel things are not, the world is crashing on you, and you just develop some mental issues that people cannot understand. So that is also one stigma that is very common with nephrotic patients. And I would advise that if you're a nephrotic patient and you can get a psychotherapist to help you walk through this journey, then it can be a bit easy for you. Because nowadays, even in the government hospitals, they have so many psychologists who can help you cope up with so many chronic illnesses. Because sometimes the kidney patients, the kidney patients and the nephrotic, most kidney patients slide into depression very easily. Because when you sit down, physically you're weighed down, mentally you're weighed down, financially you're weighed down, spiritually you're weighed down, you can easily slide into depression. That's why you need a psychotherapist who can help you walk this journey. You need a very strong support system that can hold your hand so that you don't slide into depression, because also depression is also one of the very symptoms that come along with a nephrotic patient.
Wow, very, very powerful stuff. Absolutely. Wow. And in fact, that leads me to my next question. Unless Brother Moses, do you have any thing that you want to add or ask before I ask this next
Well,
question?
well, Roselyne really caps it all. I just want to ask her
Yeah.
how you know. Well, Roselyne, I want to be honest with you. Have you reached a point whereby you contemplated suicide? Because with mental health, I know it gets to that point. At one point, personally, I was up to that level. So, did you consider did you contemplated suicide at one time?
I would say that as a person who's gone through all this, I wouldn't say that it's a walk in the park. At some
Wait,
point, you can wake up and you look at yourself and you're like, why me? You ask yourself so many questions. You say why me? Why not the other person? Why not the other person? Why not the neighbor? Why not this and that? So sometimes it can really weigh you down because you're thinking like you develop panics and anxiety. You become very anxious. You panic a lot. When you go out there, you're like, am I collapsing in the next 2 minutes? My levels are very high. Am I dying? Am I what? Am I what? So at some point, you can feel like the world, there's that weight that is on you as a patient. And sometimes you can lose it as a patient. I can't say that it's just a walk in the park. You can lose it as a patient. And sometimes when you lose it, that's why I'm saying that it's good to have psychotherapists who can walk you through that, so that you don't reach that level where now you go into a depression. And of course, when you go into a depression, you sometimes you can become suicidal. That's why I say for me it has been easy for me because I have some psychotherapists who help me through that journey, through now the mental health journey, so that I keep check on my mental health.
Wow. Perhaps that was the most liberating thing you did. Thank you so much, Roselyne. Back to you, Brother Steve.
Yes. Wow, Miss Roselyne, that was really powerful. And that leads me to my next question. How important is it for individuals with nephrotic syndrome to have a support system or network of people who understand the condition? How important
Can you repeat the question? Pardon? Just repeat the question.
Yes. How important is it for individuals with nephrotic syndrome to have a support system or network of people who understand the condition?
Personally, what I did, I think I was introduced to the support group. It's called the Renal Patients Support Group in Kenya. That's when I met people. In fact, that's when I joined the group, and I realized that we are almost 400 kidney patients, and plus their caregivers are there. So that's when I realized that there's so many people who are going through dialysis, the kidney transplant, the end-stage renal failures, nephrotic syndrome, all those kinds of kidney diseases. So when I joined that group is when I started journeying with them. We share our experiences in that group. We share our struggles, both physically, mentally, financially, in that group. And in that group is when I found there are also other nephrotic patients that we share common condition like the nephrotic syndrome. So we journey together. We with those patients. We have some walks that we do together. We share our experiences. So sometimes when you get people you can share experiences with, it gives you an encouragement because you realize that yours maybe is not as serious as, because if I'm not led into dialysis, but I have some patients there who are on dialysis, and I see their struggles with going through the dialysis, the transplants, how they suffer when on dialysis and all that. I just feel like, oh my goodness, there's really so much to offer to these people, because I can stand and I say that I'm better. At least I'm in a better position. So I would really like to be a kidney brand ambassador. I would really like to journey together with the kidney patients, especially the ones on dialysis, the ones on transplant, because I know sometimes it gets very heavy on them. And I think also with this is when I also met Moses in that renal support group. That's where I met Moses. And also, it's also good to have such kind of a forums where you need also to share your experiences. You need to educate people on some of the symptoms that they might experience and all that. And so it's good to have support system with the people who wear the same shoes like you. So when you talk about prednisolone, they know what you're talking about. When you talk about proteinuria, they understand your language. Yes.
I agree. And
Wow, really
you've
great.
been a wealth of knowledge today. Very well. We have people who commented in the section that said this is good stuff. Miss Elizabeth Oldham, she said she's grateful that we chose this topic. You can thank Brother Moses because he's the one that came up with the topic. And a young lady right now, I don't want to mess up her name. I just say I call her Love, her first name. I don't want to mess that up. But she says, thanks for talking about this subject. She's dealing with nephrotic syndrome right now. And that's why talking about kidney disease, I mean, it's not just diabetes and hypertension, which here in the United States are the two leading causes, but it encapsulates many things that cause kidney failure. And we try to tackle each one. You know, Moses and I are only two people, but we try to really talk about this disease and get people to engage and participate, especially if they're dealing with this in silent. You know, they have a place to come to share their experience, like you said, to share your experience, strength, and hope in dealing with any type of kidney disease that you may be suffering with. And so if you're dealing with kidney disease right now and it's from a different cause other than diabetes or hypertension, please reach out to Brother Moses and I so we can share your story and talk about that particular cause for kidney failure. So as we come down to pretty much the end of the show, but before we leave, Ms. Rose, is there anything that you would like to share with the audience about nephrotic syndrome? Anything you would like to leave with the audience concerning that?
I just want to talk to the audience and tell them that just what I've said before, having nephrotic syndrome is not a death sentence. You can still live a normal life. You can still go about your normal duties. The only thing that you need to do is make sure that you take your medication as prescribed by the doctor. You keep your appointments as required by the doctor, and make sure also you live you live a healthy lifestyle by checking your diet. And also I will say that in all that you do in your struggles, dedicate everything to God, because it's God. God is the one who gives you he can never give you a load that you cannot carry. So keep your trust in God, be prayerful, and trust that and just let God take control of everything. Because I can say that through all these struggles, it has drawn me closer to God. It has made me to really know who God is, and through that I give everything to Him, and I believe that when you do all these things, then actually everything will be okay with you.
Brother Moses, you have any last
Wow,
comments for
wow, wow,
Mrs.
wow,
Rose?
wow. Thank you so much, Rose. You've really inspired many, because one thing our viewers must come out with, one thing that stood out is that you can still stop the progression of CKD to end stage, where you will only need two treatment options, that is dialysis or transplant. Now, you are truly a testimony that early diagnosis and drug adherence treatment are quite fundamental in keeping off dialysis. Let me tell you, Rose, dialysis is not a good thing. That is why
I know.
we are advocating that everybody to go for test, kidney function test. And remember also that the leading cause of kidney disease are diabetes and hypertension, in that order. Thank you so much, Roselyne, for the jargon we've learned today and the audience have learned. And keep it up. We love it. Thank you so much.
Thank you.
Looking forward
Thank you so
to
much.
host you once again in a different way. Thank you so much. Back to you, Brother
Thank you so
Steve.
much. Much appreciated. Thank you.
Yes, Ms. Rose. Thank you so much. And we'd like to have you back again for a discussion.
No problem. Anytime, any day.
Okay, thank you. Thank you so much for coming on Kidney Hub East Africa. And we'll be talking with you soon. Have a great evening and night.
Thank you so much. Have a blessed night too, Moses, Steve. God bless you all.
Bye-bye. God
All right,
bless
thank you.
Bye.
So, guys, this has been a great show. And just to recap, that nephrotic syndrome is a group, it's a disorder. Hold on, let me get back to my my notes. Brother Moses, what do you think about the show?
Wow, this is a great show, Steve. I've seen there are a few comments. This is progress well made.
Absolutely.
And we are looking forward even much better.
Yes. So again, nephrotic syndrome is a kidney disorder characterized by a group of symptoms, including proteinuria. And you heard Ms. Rose say she dealt with that, like 12 grams. I only had 3 grams of spillage. 12 is a lot. Hypoalbuminemia, which she experienced, low levels of albumin in the blood, and edema, which she experienced as well, which is swelling, and hyperlipidemia, high cholesterol and triglyceride levels. She said something very important, that the high cholesterol can possibly unalive you faster than the nephrotic syndrome itself, because high cholesterol can lead to heart attack because of the fat in the arteries, clogging the arteries. So you definitely want to get checked. If you're having any of this symptoms, you go to the doctor and they say you got protein in your urine, or you got any blood, or albumin, sugar, whatever. And he said, I think you should go see a kidney specialist. Please take heed to advice. Just because you may not be experiencing, say, swelling or any other symptoms, doesn't mean that your kidneys are damaged. So, and then let me go back over the some causes before we head out, Brother Moses. Nephrotic syndrome can be caused by a variety of underlying conditions that affect the kidneys. And then some of these common causes include: 1, minimum change disease, which is the most common cause of nephrotic syndrome in children. The cause of minimum change disease is often unknown, but it is believed to be related to an abnormal immune response. Then 2, FSGS, or focal segmental glomerulosclerosis. This is a condition that can be caused by a variety of factors, including genetic predisposition, infections, drug toxicity, and other kidney diseases. Then 3, which Miss Rose had, membranous neuropathy, which is characterized by thickening of the glomerular membrane, which can be caused by autoimmune disorders, infections, and certain medications. And when we come to medications, you got to be careful, because if you're on any mental medications like lithium, that can cause abnormal kidney problems. Ibuprofen, Advil, Motrin, certain dye for x-ray. So you definitely got to be careful when you're taking medications and ask them, is this going to have any impact on my kidneys? Also, 4, diabetic neuropathy. If you got diabetes, that can damage the kidneys and cause nephrotic syndrome. And then 5, systemic lupus erythematosus, or SLE. We all know this is an immune disorder, autoimmune disease, which can affect the kidneys and lead to nephrotic syndrome. And these are just a few examples of the many possible causes. As I said, many possible causes of nephrotic syndrome. So it's very important for individuals with nephrotic syndrome to work closely with your healthcare provider to identify the underlying causes and to develop an appropriate treatment plan. Just like Ms. Rose said, she went and got a biopsy. And a lot of times they will order a biopsy to find, if they don't know what the cause of your kidney disease is, doctor will order a biopsy, kidney biopsy, and look under the microscope to see exactly what's going on. Brother Moses, any last parting words before we leave out?
Well, I just want to encourage our viewers, not necessarily kidney warriors, but everybody publicly, that this program is actually meant for all of us, whether you are sick or not, because you have the potential of sliding into CKD and then all that way through. So it is very important to get this awareness so that you can lead a healthy life. Thank you so much.
Yeah. And Brother Moses, one thing I forgot to mention, I mentioned it through the show, but let me mention it again. Guys, if you have, or you go to the doctors and you find out you had nephrotic syndrome, or you hear that, just like the young lady said, she thanked us for talking about it because she's dealing with it right now. Know that this is a treatment for nephrotic syndrome, and it often involves a combination of medications, okay, dietary adjustment, and management of symptoms. Now, common medications to treat nephrotic syndrome may include angiotensin converting enzyme, or ACE inhibitors, or angiotensin receptor blockers, or referred to as ARBs. And this is to help control blood pressure and reduce the protein urea, as well as steroids like prednisone to reduce the inflammation and decrease protein urea. Diuretics may also be prescribed to help manage the edema or swelling if you have it. in addition to medication, this is key. Dietary changes is key to reduce sodium intake and control fluid retention are often recommended. Patients are typically advised to limit their intake of salt and processed foods, as well as to consume a balanced diet that supports overall kidney health. That means we don't want to see no fried chicken, no French fries. You know, you got to eliminate processed food, fried foods, you know, at least for a while to get this thing under control. It is important for individuals with nephrotic syndrome to work closely with your healthcare team, and also, if you can, kidney dietitian, okay, to develop a personalized treatment plan that addresses your specific needs and any underlying causes of the condition. Again, this is just one of many kidney disorders that can lead to kidney failure. So without proper treatment, you know, it may progress to kidney failure. So, Brother Moses, this has been a great topic. I thank you for suggesting this topic, and hope that we could come back next week with another great topic as well. So, without that being said, guys, thank you for joining Kidney Hub East Africa. Join us next week. We apologize for anyone in East Africa who turned on at 8 when it was actually 8:45. That was my mistake in the time. So if you got anybody to blame, definitely blame me. But next week we'll be on time, ready to go. 12 p.m. Eastern Standard Time, USA, and 8 p.m. East Africa time. Thank you guys for joining. We'll see you next week. Have a good evening. Brother Moses, have a great week.
Yeah, same to you, Brother Steve. God
All
bless
right.
you.
See you guys later, and thanks for joining, everyone. Thank you so much. I was just putting up some of the comments. Let me just thank the people who joined the show. Miss Elizabeth Oldham, Frederick Odihambo. Excuse me if I don't pronounce your name correctly. Miss Martin Nguga, Miss Love, and Onyango Dismas.
Onyango. Yes.
Yes. So thank you, everyone, for joining. We see you next week. Brother Moses, again, take care and see you soon.
See you soon, Brother Steve.
All right.